The NHS is changing. It's transforming the way it does health locally. That will mean that the budgets for healthcare will move from this place, the Primary Care Trust, to here, your local family GP. We know you've got lots of questions, so we asked a local doctor to explain the changes to us. Here's what they had to say.
Will this affect the way I work?
Yes, this will affect everybody because after all this is about transforming the NHS, but we hope to involve all members of the team.
What's the plan for the 2013 handover?
Yes, the transformation team has spent a lot of time reviewing each of the options of what the PCT does in terms of functions, and we've made very good progress with regards to that. Going forward, we have implementation teams who will be deciding how this works on a practical basis.
So we're pathfinders. Does that mean we'll be handing over to GPs earlier than 2013?
No, the PCT will remain legally liable until April 2013. However, we are working very closely with the PCT in order to gradually assume responsibilities for all the PCT functions.
Will the National Board tell us how to run things?
Yes, almost certainly the NHS Commissioning Board will be giving GP collaboratives some directives as to how they are going to do things, because we have to be accountable for the public money that we are spending.
Won't there be additional phone calls into GP surgeries?
There will be initially while lines of communication are being set up, but once things have settled down, I don't think it will make a huge difference.
What if the public have any questions?
Well, the GP collaboratives each have websites and they are being kept up to date with changes as they arise, so the public could be referred to the website.
How will we work with social services to make sure that patients don't fall between the gaps?
Well, sadly, sometimes this already happens, but the GP collaboratives are going to be working very closely with Buckinghamshire County Council so that we can find ways of integrating care to make sure that patients get a holistic approach and don't fall down between those gaps.
So, what does this mean for practice managers and clusters?
Well, firstly, practices will be working very closely within their clusters to scrutinise the data about patient movements and referrals and managing things like medicines budgets. It's also true that we will be working more closely between collaboratives in order to be able to manage the health of our local population better.
Isn't this all about saving money?
No, indeed it isn't. It's very much about putting quality first. If we can get the patient pathway right first time, we can often reduce duplication and waste. We really want to, in the future, be able to give our patients the most up-to-date technology and treatments. And with an ageing population, we can only do that by modernising the NHS.